want to share with you a synopsis, sort of a report put together by the Associated Press. They spent a year examining how the health disparities between white Americans and black Americans, how those disparities have harmed seriously generations of black Americans. I wanted to talk about this. I think most white people are not aware. I'm not talking about you, gentle listener, because you do know these things just as I do. But most people, white people, are not aware that from birth to death, black Americans face far worse than white people do in measures of health. Black folk have the higher rates of infant and maternal mortality. They have the higher incidence of asthma during childhood, more difficulty treating mental illness as teenagers, higher rates of high blood pressure, higher rates of Alzheimer's, higher rates of cancer. It just goes on and on. And I think this is something that white folks need to understand, so that when talk of racial disparities come up, white people can lobby for our black brothers and sisters. I mean, it's got to come to that. For example, here's a question: why are black babies and mothers more likely to die? The Associated Press did they spent a year examining how these racial health disparities have harmed generations of black Americans. And we're talking about today, now. But black babies and new black mothers, why are they more likely to die than white babies and new mothers? Well, first of all, black women have the highest maternal mortality rate in the United States. 69.9 per 100,000 live births in 2021. That is 3 times the rate for white women. That's according to the CDC. And that rate in 2021 was a significant increase from 2020. Black babies are also more likely to die and are far more likely to be born prematurely, which that premature birth sets the stage for health issues that will follow them, you might say, through their lives. Another statistic, in 2020, there were 364,500 preterm births in the nation, about 1 in 10. And these premature birth rates were highest for black infants. It was at 14.2% between 2018 and 2020. What causes this? Well, according to the CDC and advocacy organizations, multiple factors contribute to these disparities where it concerns death rates among babies and new black mothers. For example, underlying health conditions. But more doctors, and experts have pointed to the role of structural racism that has caused inequitable access to health care. Also, it's caused implicit bias and discriminatory care. See, this is something the anti-woke people have no goddamn idea what they're talking about. I think of DeSantis and the scum in that state legislature and around the country. These white people are ignorant goddamn savages. They have no idea what black folk, black mothers, black babies have to endure because of systemic racism. Oh, well, let's not talk about systemic racism. I never owned any slaves, right? And when you consider poor health care or poor outcomes for black mothers, that in turn can increase issues for their babies, obviously. putting the babies at risk for future health problems as they mature. And again, this is something that, and I'm not trying to beat up on white people here. This is just something that we have been denied information about, and we have been lied to by scum like Ron DeSantis and these white Christian devils who can't get over the fact that they can't own slaves anymore. Why do more black kids have asthma? That's another one of the issues examined by the AP. Well, black children are more likely to have asthma, and they're more likely to be exposed to certain triggers like mold and air pollution. Think about where so many black folk in major cities and rural areas find themselves having no choice but to live. The asthma rate of kids, or the actual asthma of black kids, is often more severe than white kids and less likely to be controlled. About 4 million kids in the United States have asthma, and the percentage of black children with asthma is far higher than white kids. About 12% of black children nationwide suffer from this disease, and it is a disease, asthma, compared to 5% of white children, 2.5 times as many black children. And some of the high rates of asthma among black children are tied to genetics. For example, family histories of allergies and frequent respiratory infections. That's true, but much of the disparity in the numbers lies in the same racist factors that afflict black people's health from birth to death. And with asthma, especially for kids, where you live makes all the difference. And where you live, we know this, often depends on your race. Black Americans are more at risk of living in homes with asthma triggers like cockroaches and dust mites and mold and rodents. And research also has shown that air pollution can worsen asthma. And think of the neighborhoods, the areas of a city or a rural area where black families sometimes have no choice but to live. And according to the AP study, across this country, nearly 4 in 10 black children, 40% of black children, live in areas with poor environmental and health conditions compared to 1 in 10% of white kids. Factories. Well, factories blow nitrogen oxide and particulate matter into the atmosphere that settles in the immediate area, especially the particulate matter. Idling trucks and freeway traffic kick up noxious fumes and dust. Think about where expressways were built through major cities. Christ, all you have to do is take a look at Atlanta if you want a good example of that. And the disparities, where it concerns asthma, are built into a housing system that was shaped by the long-standing effects of slavery and laws from the Jim Crow era. Many of the communities that have substandard housing today or are located near toxic sites are the same neighborhoods as those that were segregated and redlined years ago. You know about redlining, I hope, by now. All right. Next is, how does racism affect the mental health of black teenagers? Well, according to this study done by the Associated Press, about 50% of black kids experience moderate to severe symptoms of depression, and about 18% said they were exposed to racial trauma often or very often in their life. Now, just pause for a moment. 50% of black kids experience symptoms of depression, moderate to severe. The drivers, the causes of the mental health crisis for black kids, they begin early and persist throughout a lifetime. Now we're talking about racism. Black kids' first encounters with racism, according to the study, can start before they're even in school. And black teenagers report experiencing an average of 5 instances of racial discrimination per day. And young black students are often perceived as less innocent or older than their real age, which leads to disproportionately harsher discipline in the schools. That's something that all white people should know about. We should know about these statistics. And I maintain if we don't, this is another example of willful ignorance. Again, I want to be clear. I'm not trying to beat up on white people, although a lot of white people deserve a good ass kicking. I admit that. But just to be aware of this so that we can do something about it in partnership with our black brothers and sisters. We've got to. And then black adolescents are far less likely than white adolescents to seek and find mental health care. And in part, that's because black families often distrust the medical system after generations of mistreatment. Think Tuskegee experiments. Or from a lack of access to care, up to being subjected to racist practices and experimentation that black folk have long suffered in white America. I mean, this is the truth. These are facts. I would just beg people who listen to this podcast, and I know it's begging kind of stupidly because I don't have to beg my listeners to accept this, but to be aware of what black folk have been subjected to since forever. It's just so goddamn unfair, so brutal, so criminal, so rotten. This country also has a shortage of mental health care providers who understand the roles of racial identity and how that role, and coupled with racism, how it all plays into shaping the mental health of young black kids, young black people. Research and health surveillance, according to the Associated Press, the data point to a growing mental health crisis among black youth. Between 1991 and 2019, black adolescents had the highest increase among any other group in prevalence of suicide attempts, a rise of nearly 80%. God damn it. This is so unfair to kids who start out with as innocent as any kid can be, and yet immediately, if it's a black child, an African-American child, however you want to identify, person, kid of color, whatever, almost immediately they're subjected to systemic, institutionalized racism. The kind of torture that assholes like Ron DeSantis say doesn't even exist. High blood pressure. How many black folk do you know, if you are friends with black folk, how many do you know that suffer from high blood pressure? Practically every black person that I have come to know over the course of my life, not just now, but over the course of my life, even young kids, teenagers when I was younger, in the 20s, had a blood pressure issue. Now, high blood pressure has played a major role in people who die of COVID-19, and especially in the COVID-19 deaths of black folk. Once again, taken together, COVID-19 and high blood pressure create a deadly combination. The AP reports that while it is listed as a contributing factor, high blood pressure, in 15.5% of the deaths of white COVID sufferers, the figure for black victims of high blood pressure, the death rate, is 21.4%. That's the highest of any racial group. Once again, you see? Now, again, according to the AP, about 56% of black adults have high blood pressure compared with 48% of white people. 3 out of 4 African Americans are likely to develop high blood pressure by age 55, 75%, while only 32% of white adults with high blood pressure have their condition under control with medication. The figure for black Americans is even lower, 25%. That's another thing I don't quite understand, why anybody, black or white, if you have a blood pressure issue, my God, there are blood pressure drugs right now that are so cheap they're almost free. And these statistics on blood pressure are likely to get worse. According to CDC projections, by the year 2060, okay, you won't be here, neither will I, but the number of Americans battling cardiovascular disease is expected to increase drastically. High blood pressure rates alone over the next 35 years are projected to rise by almost 30%, or roughly from, using today's population figures here, from 128 million Americans to 163 million Americans. And you know what part of that comes as a result, how am I trying? The result of that, the increase in blood pressure, comes in part because of the rotten, filthy diet that so many of us, black and white, inject into our bodies. We are acting like suicidal maniacs, especially where it concerns fast food. Jesus, God. Calm down, Malloy. Among white people, the prevalence of cardiovascular risk factors and disease is projected to decrease over time. Yet, significant increases are projected among people of color, especially black and Latino Americans. Again, think diet. Think the term food desert, where a black neighborhood will not have a major supermarket that sells fresh produce, fresh fruits and vegetables, fresh dairy products, fresh anything. And like many conditions, genetics do play a part. And experts, like I've just done, blame in part poor diets, high cholesterol, obesity, and smoking. All of this contributes to blood pressure issues, but especially the higher rates that exist in black communities. And also, in recent years, according to the study, more academics and doctors have called attention to structural inequities. That would be institutionalized racism that have an outsized impact where it concerns blood pressure issues. Black neighborhoods are more likely to experience a lack of access to healthy foods. Black neighborhoods are usually inundated with fast food options. I mean, this is so unfair. It's so poisonous. It's so cruel. Why do so many black people develop Alzheimer's? I didn't know this, but black Americans are more likely than white people to develop Alzheimer's. About 14% of black Americans over the age of 65 already have Alzheimer's, compared with 10% of white Americans. That's according, again, to CDC. And experts believe the rates actually are probably even higher, undiagnosed Alzheimer's. And that's probably true for both racial groups. But when you take everything else into consideration, we know that the undiagnosed cases are going to be higher among our black brothers and sisters. We know this, or we should know it. And the report goes on to say, the investigation by the AP, that health conditions like cardiovascular disease and diabetes if it's experienced in earlier stages of life, those are known risk factors for Alzheimer's later on in life. And both of those, cardiovascular disease and diabetes, are more common among Black and Latino populations. Also, where it concerns Alzheimer's, depression, high blood pressure, obesity, and chronic stress. Chronic stress are also risk factors for Alzheimer's. And the CDC also acknowledges the impact of what they call, quote, higher rates of poverty and greater exposure to adversity and discrimination, end quote, as risk factors for Alzheimer's. Think about that for a second. Nobody asked to be born Black, white, Latino, in China, in Canada, in Argentina. Nobody asked for their life. Nobody asked for their racial identity, their national identity, their genetic identity. It happens because of those who have gone before us, right? So why does the greater society, the larger society, apply stress, this chronic stress, systemic racism, to people of color in this country and others, but I'm talking about the United States? And across the board, Black folk are also unlikely to receive the health care that white people do, including the necessary medication to try to treat at least the progression of Alzheimer's and other dementia-related disorders. A preliminary study that was released this year by Mount Sinai Hospital, researchers found that Black folk are less likely to receive dementia-related medications than white people. No surprise there, given the racial disparity that exists across every sector of American culture. Black and Latino populations dealing with Alzheimer's are expected to rise in coming years, and so are the number of their cases of other related mental disorders. Cases among Black Americans are projected to increase 4 times over today's estimates, and Latino Americans could increase 7 times. This is according to the CDC. Some advocates estimate that by 2030, 7 years from now, nearly 40% of all Americans living with Alzheimer's could be Black or Latino. But this projected rise in cases isn't just a factor of population growth. Evidence exists that certain genetic risk factors could differ by race and be a driver of Alzheimer's. But the larger disparities among racial groups can't be explained just by genetics, according to the experts. And the sheer trauma of experiencing racism from day one for Black Americans is believed to be a contributing factor to mental deterioration. Why, hell yes. I want you to try. Well, I'm just suggesting this. I've done it. It's very difficult to do, but it can give you just a fleeting idea, not a sense of experiential knowledge, but a fleeting idea. If you do this, if you're white, just try to imagine what your life would be like if you were a Black person in this country. Not an idealized way. I mean, you can't say, well, if I were a Black person, I would do, well, first of all, I'd get my PhD or whatever. No. You can't. That's not what I mean. Given the reality that Black folk experience in this country, everything from employment to education to health care, all of it. Given that reality, try to picture yourself, my white brother or sister, as a Black American, and how you would deal, knowing that every time you left your house, you ran the risk of being killed. Now, somebody can say, okay, Malloy, that's true for all of us. What about car wrecks? What about trees falling? What about lightning strikes? Okay. But you know what I'm saying. That if you control your little experiment here for, lightning strikes and car wrecks, and just take a look at what a black person experiences vis-a-vis what a white person experiences when both leave their homes, you're only going to come to one conclusion. Hi, Truth Seekers. Mike Malloy here. The Progressive Voices Network brings you commercial-free commentary from today's leading progressive radio hosts and pundits, like me, Mike Malloy, 24 hours a day. I'm not your typical old guy from the 80s or the 90s talk radio host, and Progressive Voices is not your typical talk radio network. It's a listener-supported nonprofit with no corporate control whatsoever over our broadcast. So hosts like me, Mike Malloy, are free to rant and scream and carry on about whatever we like. We're often controversial, but we're never boring. Weeknights, 9 p.m. in the East, 6 p.m. in the West on the Progressive Voices Network. Always progressive, always on. I'm Mike Malloy. Keep it lit.